Hello. We're just about to start the webinar for people who are signing up. We're going to wait a couple minutes just to make sure anyone who's coming on late, you have the ability to just stare at us if you like for a minute or two. It's a little weird staring at blank faces, isn't it? Okay. All right. We will start a webinar. Welcome to WellWell's first webinar program, one of many that we'll be running with a variety of experts and interesting people, and the information and the presentation, the productions are designed to enlighten, inform, amuse, maybe provoke. And you're not here to disagree. We appreciate anybody signing up, but you're certainly not here to accept what our guests say, but maybe learn from them and even push back where you think they're being a little loony or crazy, which could happen. Today, our first program is on managing back pain with Suzanne Osnett, who is the founder of Move2Live.now, a New Jersey-based organization and facility and practice. Suzanne specializes in Feldenkrais. She's a registered Feldenkrais practitioner. She has thousands or at least hundreds of hours in training in both Feldenkrais and yoga. She incorporates therapeutic yoga into her practice, but it is fundamentally a Feldenkrais method practice. As Suzanne will go on to explain this a little bit better than I will in a moment or two. But today's session is really on managing back pain, which is amazingly chronic in this country and widespread. And we pulled some numbers just to show quite how significant this problem is. And I think some of you may be amazed at this. Every year, 50% of Americans experience back pain. Over their lifetime, 80% of Americans will experience back pain. It is the #1 cause of disability in this country. It is the most common reason for missing work. And this results in $80 billion in lost productivity for U.S. companies every year. Americans spend over $50 billion a year trying to treat back pain. And then this is a fascinating statistic. This is from byproduct of Georgetown University and goodbody.com. They report that 3 million years of productive life is lost every year due to back pain. I have no idea what that means, but I think it's a startling statistic. So I just, with that, I want to introduce Suzanne, which I did a bit, have her say hello and tell us a little bit about her background. And then we'll start exploring what causes back pain, maybe how to treat it, how Suzanne approaches treatment, how it may differ, and what you may need to know. So Suzanne, welcome to WellWell's inaugural podcast, webinar rather, and please tell us how you got into Feldenkrais, treating back pain, or treating all sorts of pain and issues.
Hi, John. Thank you. Happy to be here. So the first 20 years of my life I spent as a journalist, and then I went into yoga, and I did 10 years of yoga. And then I was very interested in teaching yoga in body awareness and how to help people really sense themselves. And I was taking a year-long anatomy course, and it happened to be held at the Feldenkrais Institute. And one day they were offering a free day. And our teacher said, if you've never done the Feldenkrais method, you should try it. So I took the one-day seminar, and I was just fascinated. I had neck issues because I had gone to the doctor, and they told me I had stenosis, and I should not move my head too much, either flexing or extending or turning. And so I basically held myself very rigidly. and for years. And at the end of the session, I could turn my head easily. I had no pain, and I was hooked. So that's really how I got into the Feldenkrais method.
And explain for now, just give us a tidbit on how Feldenkrais approaches stuff. We're going to get into this a little more detail later on, but because Feldenkrais isn't very common in this country. I know it's more common than it was, but certainly it's more common in places like Israel, where Dr. Feldenkrais, I think, lived. I don't know if he was I believe he was from Europe, but lived in Israel, developed the concept. And it's also more common in parts of Europe as well, from what I understand. Not that there aren't practitioners over here, of course there are. So just a little bit about how it approaches.
How it approaches back pain? Well,
or just in general, the approach of Feldenkrais.
So we tend to look at movement in general. So if somebody comes in back pain, the first question I would ask them is, when does it hurt? Does it hurt if you reach up? Is that when you get a pain? Does it hurt when you sit, when you lie down, when you bend down to pick something up? Or is it chronic? Is it constant? And then once you start identifying movement patterns where the pain is prominent, then you begin to look at, different potential ways to treat it.
So it to a certain extent, it's really sort of bringing your body, and I know we're going to go into this more too, bringing your body and your movements back into a natural alignment or more effective or efficient?
More, I'd say, efficient and more functional. Because most people, honestly, if you ask them how do they get up from a chair, and if you just think about it, if you say, oh, I'm going to get up from a chair, do you really know what you do? And most people don't, right? So, and many, think of how many times you get up and down from a chair. So if you get up from a chair and you're sitting way back in the chair, chances are you're using your back instead of your hip joints. And so you are straining, you're straining your back when you get up. And it's the same for if you bend down to pick something up. People don't use their skeleton and their muscles effectively. And so we kind of teach them how to do that.
Okay. And again, we'll get into this a little more, but let's talk about back pain for a minute. We know that it's incredibly common. We know that it's painful. We know it's costly, both to the individual and to the country and families and all of that sort of thing. Why is it so common?
There are many reasons for that. One is posture. So people spend a lot of time sitting. And what is your sitting posture? So most people tend to sit back in their chairs, right? So they have if you're sitting back, most people are a little rounded. They have their hands on a computer. They have a forward carriage of the head. And that puts tremendous pressure on the discs, right? So in movement, you want your spine to have the ability to lengthen. So sitting is, you could say, poor sitting posture is one cause of back pain. It could be also poor breathing. Often people do not understand how to breathe diaphragmatically, and they have an over tight core. So people tend to do they want strong cores, and they think of sit-ups, and they strengthen.
But for a second, just what is the core? Because it's common. It's a common phrase. People may have different ideas of what core means.
So often people say, oh, you have back pain, you have to develop core strength. And that is really a fallacy. The core, really, you need to think of it as the whole trunk. So if you think of a shopping bag, at the bottom of the shopping bag is your pelvic floor, right? And at the top here is your diaphragm. And the core is both the front and the back. So your back muscles are part of the core. Your obliques, which go like this and then go the other way on the sides, are part of your core. Very important, the lower belly, which is the transversus abdominis, which goes around in front and back like a corset, is part of your core. And then, of course, you have the muscles that most people just kind of think of as the core, which is the six-pack, the rectus abdominis. But all of those muscles form the core. And if some of them are too tight, especially the rectus, the six-pack, it prevents the spine from moving freely. And if you think of the spine, there are different curves of the spine, and you want to be able to maintain them. But if there's too much excessive contraction, that can't happen. So that's why one of the ways to, when there is back pain, is we teach people breathing. And there have been studies, serious studies, that show that teaching people breathing, and it's not one technique, different ways of breathing can relax some of that excessive contraction in the lower belly and in the rectus abdominis and reduce chronic back pain.
So stress, contraction will happen. We'll all cause back pain.
Will all cause back pain. And then, I mean, there are many other things. Restricted movement of the head and neck. So if you're constantly like this, you're not going to be able to turn properly. You're not going to be able to lengthen. If you turn, right, if you rotate, everybody turns, whether you're taking something out of the fridge or the dishwasher. If you're constantly, what's the opposite of lengthening? Shrinking when you turn, right, and not lengthening, that compresses the discs. And when you have too much compression, that's when the discs go out of alignment. Also, I would say a lack of coordination in the hips, pelvis, head, and spine. They all need to work together, and that's one thing the Feldenkrais method is very good at. We look and see how all the different parts of you work together. And often in not all therapies, but other therapies, they tend to isolate. And we really look at how the whole skeleton moves. Mm-hmm. For example, if somebody always stands with the weight on one leg, you know how you have people might have their hands on their hip and they stand to one side. Well, it's not the side that you're standing on that actually is working harder. It's the opposite side that is working harder. And that creates all kind of unnecessary contractions and misalignments. And the problem is we all have bad habits, and you need habits to live. You don't want to have to think of everything you do. Habits are essential to life. But if you think of children, they never have back pain, right? Children move in all different directions. They do all different movements. But as you get older and you're forced to sit at school and you sit in ways that are not necessarily good and you're told don't fidget, right? Bad habits start, and then they continue during our life unless we happen to do a lot of movement.
What about things like people picking up things, straining their back, that sort of stuff? That seems a little bit different than the common pattern of what you're talking about, bad posture.
But that's...
Obviously, they create back pain. You've identified that. But a lot of people also get back pain, I'm assuming, when they pick something up or you've mentioned twisting improperly. And certainly athletes, you look at the number of back pains professional athletes or even amateurs, weekend warriors will get from playing softball, soccer, golf, tennis, that sort of thing. Because
it's poor use of body mechanics. Now, great athletes don't tend to do that. Great athletes really understand how to move their bodies, and they're very aware. They have body awareness. They have a really heightened body awareness. But most of us don't. I mean, it's something you can acquire, and it's something that the Feldenkrais method really teaches, and yoga teaches that as well. But what we teach is how do you become aware of how you do what you do. Mm-hmm. And when you have a problem like back pain, if it's chronic or even if it's just, you have an attack, it's very important to learn how to move differently. Most people don't realize that they have choices in movement. And there's a very interesting statistic in terms of our full potential of movement. Great athletes use about 6%. Most of us use 3% in terms of your full potential of what you can do with the body. So if you improve by just a little iota, it's huge in terms of, what you can do. And we also have another saying with the Feldenkrais method is that we make the impossible possible. Think about it from a movement perspective. The difficult, easy, and the easy, elegant.
Okay. And what about, and then there are obviously, those are movement issues. And then there are people with chronic issues or injuries, which great pain, obviously, but are a little different.
So that's different. And I mean, obviously, your first thing is you go to a doctor, because it could be if somebody has incontinence, right? That means that the nerves are affected at a certain place in the spine, and that you need a different kind of treatment. Nothing, you need medical intervention.
Mm-hmm.
Or if they have suddenly muscle weakness in the leg, which would result in like a dropped foot, that needs medical intervention. So it just depends what it is. But common symptoms like sciatica, where you get pain down the leg,
Mm-hmm.
or you get an ache on one side of the lower back, which is a sacroiliac joint issue, or even just a sharp pain, a spasm. You can get a spasm anytime. I once got a spasm. I woke up from bed and I literally I could barely get up. And what most people do, if they don't know, is they panic. And when you panic, everything gets even tighter. So it's absolutely the worst thing you can do. And that's why being able to breathe and understand how you can explore the breath and develop the breath can make a huge difference, for people.
Let's talk a little bit. There are a lot of different ways to treat pain, and certainly surgery, and there are medical. It's all medical, but there's surgery, there's extreme methods, there's chiropractic, there's physical therapy, certainly the Alexander technique, there's therapeutic yoga. They're all effective to a certain extent, I would assume. I mean, I know you all have different takes on this. Are some treatments more effective for certain types of issues than others? And a little bit, how is Feldenkrais different than, let's say, a physical therapist or a chiropractor, or Alexander technique? And I don't mean you don't have to identify everyone.
They're all very different. For the Feldenkrais method, what you really need are two things. You need curiosity and an ability to pay attention. And if a person has that ability to pay attention and is curious, I think it's a very effective method for treating back pain. As I said before, we tend to deal with the whole body, so we look at how somebody moves in all ways. It can be taught in two different ways, either as a class or just giving people verbal directions, or somebody lies on a table fully clothed and the practitioner moves them very gently. With physical therapy, right? It's different. They not always, but often they feel that you need to strengthen certain parts, certain muscles. And in certain cases, that may be true. So somebody with recurrent back pain may need to strengthen their glutes, okay? That may very well be. Or they need to strengthen their spinal muscles. Now, we do that too, but we don't do it in isolation. So that if you're strengthening your spinal muscles, you're doing, say you're lying on your belly and you're taught how do you lift your head? Well, we just don't give those directions. We tell them to pay attention to lots of different things. And I guess I find that the Feldenkrais method is a more integrated approach. Mm-hmm. And it's a dialogue. It's never, people don't come to me to be fixed. It's really a joint exploration of how they can improve. And I think often when you go to a different methodology, not all of them, but some of them, there's the expectation, fix me. And we are not like that at all.
Just as an aside, I'm getting a report that I'm getting feedback when I speak. I'm sorry, lost words there for a minute. We are trying to correct that, so just bear with us. You get to hear me twice, which should excite some of you to no end. So we'll work on that a little bit. I'm told that Suzanne is coming across clearly, which probably means she's making more sense than I am. Some of the myths about treating back pain. What are? I mean, it seems like it's everything from Well, I don't know. Well, tell me what some of the myths are.
I think the two biggest myths that I hear all the time is stretching. Like, and that if you stretch, say, and it's natural, something feels really tight, and what do you want to do? You want to stretch. Well, that is often counterproductive and can lead to more distress, right? And they have proved, there have been many studies, in the last 5 years that say stretching is really not necessary. It feels good, and there's nothing wrong with stretching. It feels good, but you don't need to stretch when you have back pain. So that's one myth. The other myth is core strength, that if you have back pain, you got to develop core strength. Mm-hmm. And a recent study said that what you need to do in terms of core strength, it's like a whisper, meaning very, very little. And I'm going to show you something that if you just bring your arms up a little bit, if you were standing and you just bring your arms up a little, you should feel, right, a little contraction in your lower belly. And that's all you need in terms of core strength, in terms of your back. It's literally a whisper. And, studies have proven that. And it's something that people just don't believe. That myth stays with us. And actually, the people who have really tight abs are often the people who have the most problems with constant back pain.
Which is problem. I don't have any problems with back pain. What about integrating different treatments at the same time? Is that acceptable? Is it? I mean, obviously, you have all different practitioners working, and some will say something. But from your perspective, is it possible? Is it acceptable? Is it why?
It just depends on the person and their comfort zone. I want the people I work with to feel safe. That's number one. So if they feel safer, right, going to see a physical therapist as well as me, that's fine. And what I tell them is that to show me the exercises that the PT has given them, and then I teach them how to do them better, how to sense themselves, the whole of themselves as they're doing the movement. And that usually creates, I get it now, because physical therapists don't focus on that. So it honestly depends. Chiropractic is such a different method. I usually say, if you want to do that, do that.
Do it separately.
Do it separately, because the Feldenkrais method, what makes it really different, we are a learning methodology. We are a teaching methodology. I tend to refer to the people who come to see me as students, not clients. It's all about learning. And we teach people how to sense themselves, how to feel themselves, how to move, and how to think. And how do you do that all together? When you move, how do you feel? How do you sense? It requires all those things. So that's why it's mind body.
But it's more than just, I don't want to say more than, in addition to just that sort of balance, that awareness, the Feldenkrais method will address pain issues, or can address pain issues.
Totally. I'd say, honestly, most of the people who come to see me have pain, and they've come because PT has not helped. They've done acupuncture. They've done all these other methodologies. They've tried them, and the pain keeps coming back, or it hasn't helped at all. And most of the time, I get people as a last resort, or people have gone to massage, and So
I got it. What about it? And obviously, Feldenkrais isn't limited simply to back pain. I assume this approach can be applied to joint pain, jaw pain, big issue, and other neck pain and other issues like that.
Totally. I mean, I have people coming for shoulder pain, for jaw pain. TMJ is a big issue when people clench, and teaching them how to unclench and pay attention. People come because they have eye issues, hip issues, walking. it runs the gamut, but it's not just pain. You also have athletes who want to improve their athletic performance, and or musicians or actors, and they want to improve because it's all about improvement, growing, learning. And so everything you do, whether it's movement as an athlete or speech, acting, can improve. And so you get people who do that, or they want to improve dancing. You could have a dancer who pirouettes beautifully to the right, but then when they go to the left, something's not quite right. They can do it, but it's off. That would be a perfect example why a dancer might.
They gain body awareness that helps them.
Huge body awareness, and then it's the body awareness. It's all in the brain. So we deal with the skeleton, yes, and with the muscles, yes, but we deal with the brain. So it's how do you reconfigure the synapses in the brain? How do the neurons that fire together work together, and we're creating a different pattern, whether you're doing it with your hands and you're doing gentle movements that will change somebody's ability to feel themselves, or whether you're doing it verbally. But it's honestly really more than anything else, it's about rewiring the brain through gentle movement and gentle touch.
Can you explain gentle touch? I was about to ask you that, because physical therapy and chiropractic, they seem to be, I don't want to say violent, but they're certainly involved in a more...
They can definitely be more invasive, okay? And there are times in PT where you have to be more invasive because you have to destroy scar tissue. So there's no question that sometimes it's totally necessary. But I'd say 90% of the time, we don't do that. So if somebody has pain in their neck, that's the last place I'm going to go. I might work on their feet if they're lying on a table and look at the movement in the ankles and see how that connects through their hip joint, up the spine, and into the neck and the head. So we don't start with the issue where there's the most pain. We look at all the causes that might be contributing to that elsewhere. It's like you have a victim and you have the culprit, right? So the culprit is not necessarily where the pain is. It could be in many different areas.
And gentle touch is small movements.
And it's very small. Yeah, it's very delicate, and you're in constant conversation with your student to make sure that nothing you do is causing them to tense up. Because if you do something where their nervous system suddenly gets jittery and they don't feel safe, what happens? Everybody tightens up, and you want the opposite of that.
I'm sorry.
That's it. And often what we do, this is kind of interesting and I think different than other forms of therapy, is, for example, if somebody is very rounded like this, right? We might, if I'm working on them, I might round them a little more, because by rounding them a little more and going into their pattern, that actually tends to release the pattern so they can go in the other direction. So in back pain, and this is not true, it depends for all kinds of back pains, just some kinds of back pain, you might be teaching somebody lying on their back, they might be rounding themselves. So they might have a hand behind their head and a hand on their knee, and you're not trying to touch the elbow to the knee, you're just going in that direction, but by contracting the front more, you release the back, you lengthen the back, and the front also releases. Because often what happens with people is they co-contract. So the front is contracted, the back is contracted, and then you have a real mess.
Now, this next answer is going to be dependent on the issue, but someone with back pain, and can they continue to practice yoga? Can they do other things? And that's different than treatment, because people don't want to give up certain things they're doing. Obviously, unless the pain is so great, they can't do it. But what would you recommend? It could be other exercises too, I assume.
You're not going to like this answer. It depends. With Feldenkrais, practically our answer is always, it depends. It depends on what the problem is and how they do the movement. So often with, say, yoga, can they continue yoga? They might be able to, but there are certain movements that they might not be able to do, or they might have to do less. They might have to really reduce the movement, the scope of the movement. And in yoga, people are used to going to the extreme stretch. So they would have to do a tiny bit. And it depends if people have the discipline to do that and the awareness to feel. Because if you go slowly, you can feel the exact moment when it's not, I shouldn't go there.
Okay, fair enough. And I've just lost my train of thought, but I'm going to pick it right back up. How does, obviously during the pandemic, from what I understand, you and all practitioners did a lot of online one-on-one sessions. But whether it's a one-on-one session, can the Feldenkrais practice for pain we're talking about now be taught or engaged in a classroom setting? I mean, a larger setting with multiple people? Does it have to be one-on-one? How does it work?
Absolutely. It can be taught in a class on Zoom where, I mean, you need to be able to see everybody. So if you have a big screen, you might be able to see 20 people fairly easily, and you can give directions. And Dr. Feldenkrais developed over 2,000 lessons. I haven't done them all. So you have a huge variety to choose from. And so people are instructed verbally to do small movements, but they're all towards improving a certain function. So what are functions, right? One function would be rounding yourself. So that's flexing. Another function would be extending. Another function would be side bending, right, side to side. And another function would be turning.
Would these deal with a particular pain issue, or that is more of a general well-being?
No, that is more general well-being. And I would say if somebody has acute pain, they need to do one-on-one sessions. Yeah, you would not do that for that. You can teach movement in a class for acute pain, but it would be a very different kind of class. It would be geared to people who are in pain. And we do that.
The same type of pain or similar types of issues. Okay.
You'd be teaching a lot of breathing and different breathing practices. And you would be teaching very gentle movement and giving much more ways that people could adapt.
How effective has it been? Because from what I understand, you did a lot of, you have a lot of single clients who come to you. And a lot of these clients were obviously coming for personal sessions. The pandemic hit and you began doing lots of Zoom sessions, I believe. How effective have the online sessions been compared to the personal session? I mean, the physically.
So it's very interesting. It depends on the person. I have one student who's a lawyer and he's used to preparation. That's just what he does. And so because we record the sessions, he goes back every week and he studies the session. He studies what he's done and he studies my comments, and then he practices, and he's made tremendous progress. But so for that kind of person, Zoom is very good. For other people who say don't have the discipline of practice and they want hands-on touch, obviously Zoom isn't going to do that. But I'd say what Zoom does is it teaches people to be more self-reliant. Mm-hmm. And if they, because you don't have the hands-on touch. I'm not there to kind of do a movement that they can sense and feel, and they say, oh, so that's what you want me to do. So I have to be clearer in my directions, but they also have to explore more and then come back to me with questions and say, when I do this, this happens, I'm not sure about this. Or they just have to, they think they're following an instruction, but they're not. And then when they actually see it on a video, they say, oh, wow, I thought I was doing something, but they realize they weren't. So that can be really illuminating.
Gotcha. What about, we're going to open up the questions from the audience in a second, and there are a bunch that have already come in. Are there simple things people can do? Well, let me just go back for 1 second. Someone comes to you for a Zoom class or in-person class, and obviously those will start again if they haven't already for you. Is there generally a number of sessions before they feel better? And it's probably going to be, it depends on the individual, depends on how serious the issue is, depends on how aware they are, probably depends on whether they practice when they're really not engaged with you.
Yes.
Got it.
You got the question. But there's simple things people can do. So one of the big things we talked about was poor sitting contributes to back pain, right? So a very simple thing people can do is sit more at the edge of the chair, right? And, have more of a hard chair than a very soft, mushy chair. And if they take one hand under one sitting bone and kind of move it back and out, and then the other, they expose the bones. And so now they're sitting more on the bones. So that will be more effective for being on the computer and for the ability for the spine to be able to move, whether they're going a little to the right, to the left. Most people, as I said before, sit back, right? And that's your if you think of it, your back is all curved. You have more of your thighs on the chair, and that's not really conducive, for good sitting posture. The other thing people can do easily is get a special soft contoured pillow so they can sit more back, but they can maintain the curves of the spine. So okay. I'd say that's a huge thing people can do. And the other big thing they can do is breathing, to take some, even online, there's so many breath awareness free exercises that people can do, and that can make a huge difference.
Okay. And when do people need to go to a doctor? Is that the first thing they should do and then see what the issue is, or I don't know?
I think it's always good to go to a doctor first because you don't know, but especially if you suddenly lose weight, you get muscle weakness in a leg, so your foot drops, or you have incontinence. Those can be serious issues. But I'd say in general, it's just it's good practice. But it's scary because you can get a spasm and you can't move. And you think, oh God, what's happening to me? Is this going to last forever? And I'd say the most important thing is it won't. Don't panic, slow down. And it's, I lost my train of thought, but the main thing is don't panic because it's not forever.
Okay. Chances are it's not forever. Chances are okay. And it seems to me that we're more aware of back issues now than we were 5 or 10 years ago. Do you think that's the case? Do you think people could progressively get more and more aware of back issues, or not? Maybe they're aware of it, but they still don't, in general?
I think people talk about it more. It's probably more talked about. I don't know if it's more prevalent. I think it's always been there. But as people sit more and don't move, or don't, just walking can make a huge difference. It doesn't have to be lifting weights or anything like that.
And is that dangerous for your back, lifting weights? Obviously, probably if you do it improperly.
Only if you do it improperly.
Right. Okay. All right. Now, I thank you. We're going to open this. We do have a number of questions, so I'm going to start giving some questions from the audience. We have a question from a Mr. Amazu, who I believe lives in Illinois. And he asks, and I hope I don't screw this up, why do you think teaching correct body posture is not necessarily a priority for kids and teens in school? And at what age should these younger people be aware of that? So why aren't schools doing it, and when should they be thinking about it?
Well, it's a great question. Why they don't do it is, I think it's ignorance. They don't know. In Israel, the Feldenkrais method, there are classes. It's taught in schools. Here, that's just not the case. I think it should be taught as soon as, as part of gym. And then I just want to say one thing. It's not correct posture. Yes, there are things that are more efficient in terms of movement, but you want to have choices. So it's not like you want to draw your shoulders back and be rigid. That's not at all what it's about. It's more about sensing and feeling differences and having different ways of doing something. So we're not trying to be correct, if that makes any sense.
But would my posture, I don't want to say correct posture, but appropriate posture be different than, say, Mr. Amazu's posture in Illinois? Or is it the same, I don't know what shape this guy's in.
But it's not the same thing for everybody, because everybody's different. So the way you sit will be different than the way Mr. Amazu sits because of the whole habits of your life. So you will feel the movements differently. You will do the movements differently. So it depends, but I think it should be taught in schools, and I think it's just lack of knowledge, and now, by the way, the Feldenkrais method is taught in PT schools. I think they have a month of it. So at least more people are educated as to what it can offer, and people just don't know.
And sort of in line with this line of question, I'm sure Mr. Amazu is in great shape. I don't mean to imply he's not. Does the Feldenkrais method, can you apply it directly? I mean, I guess it can be applied directly to children. What about infants and that sort of thing too? Because I believe there's an element. It may be a different an adaptation of Feldenkrais.
So the Feldenkrais method, he based it on how both babies learn and how babies move. And if you think of how a baby learns, it's not like we learn by rote or by studying it's like they learn by experimentation, and they'll do a movement thousands of ways until they find, that works, and they can turn over. So the Feldenkrais method is based on both how they learn and how they move. So yes, there is a method called child space that we do with babies, and where we teach the parents how to touch different kinds of touches that can develop body awareness for the babies, and also movements, very, very gentle movements that can help them turn onto their bellies or help them come up to sit. So there's a whole methodology for babies, and for children as well.
Okay, cool. We have another question from Mr. Duran in Jersey City, and I believe that's got to be Jersey City, New York. Jersey City, New Jersey, rather, not Jersey City, New York, or Jersey City in Britain. Does the Feldenkrais method work for people with imbalances? And I'm not sure whether we're talking about emotional imbalances or physical imbalances here. And maybe it works for both or doesn't work for either.
It works for both. Because we deal with the nervous system, it works beautifully for people with anxiety, with psychological issues, with stress. So yes, for that. And of course, it deals with physical imbalances. And literally, when people have balance issues, just in terms of walking, if you've had a stroke and you're really off balance, or as you get older, your balance, you can start losing your balance. It works very well for that as well.
Okay. And yet another question. This comes from the Commonwealth of Massachusetts, to Mr. Garrity. He notes he has arthritis in one knee. In a situation like this, where the source isn't per se muscular, can this type of therapy help?
Yes, definitely. It can help because it'll teach you really small movements that you can do that won't create pain. So if you think about it, the knee is situated between your hip joint and your ankle joint. So I would say to you, if you're lying on your back and you bring one knee into your chest and you start playing with little movements of the ankle, you could flex and point and then maybe make really small circles. That is going to affect what's happening in your knee and your hip joint. So you wouldn't deal directly with the knee, you would deal with the two joints in between. But yes, there are definitely things you could do to improve mobility there.
Okay. All right. Good. I think that's all the questions. If there are any more questions, people need to ratchet them, slap them right on the chat room right now, because on your screen, people who are watching, and we thank you for that. If you want to get in touch with Suzanne, if you want to learn more about the Feldenkrais method, or just ask questions about, how it's approached, or what issues you may have. Another question did come up, and I will get to this in a second. You can contact Suzanne at her website at move to the numeral to livenow.com. That's move numeral to livenow.com. And you can also reach her at her email at Suzanne with an Z, SUZANNE, Ausnit, AUSNIT, gmail.com. I believe that email is also on her website. And Suzanne has also been kind enough to provide a special offer for anyone listening today on our website. And if you go to your offer buttons, you will see that there's a discount Suzanne has offered anyone who is on this site or watching this website, and probably would extend this to friends of people watching this website. She's willing to offer a 50% discount with a free consultation for a one-time session for anyone. And you can go to our Move to Live discount or offer session to get that. And obviously contact Suzanne too. If you have any questions, or Suzanne isn't going to answer your questions, which I know she will, you can also contact us at info@wellwellusa.com. That's info@wellwellusa.com. Let me get to this other question before we sign off. This is also out of Jersey City. Mr. Feldenkrais practiced judo. Did he integrate judo, or is judo in some way integrated into the process that he taught?
Very much. A lot of the method is based on judo, because in judo you have to learn how to fall, you have to learn how to roll. And one of the big human fears is the fear of falling. And we have that since we're babies, right? So once you learn to fall, and we do movements where we teach people tiny movements, how to fall, how to recover from falling. And that he all got from judo. And I want to say one more thing for back pain. There's a wonderful book written by a journalist who had back pain. And so she did an investigative reporting on the causes of back pain and all the different therapies for back pain, and exposed a lot of very interesting stuff and all the available research. So I just wanted to mention the book. It's called Crooked: Outwitting the Back Pain Industry by Catherine Jacobson Raman. And anybody who is interested in back pain, before you consider surgery, read that book. She interviewed 100 spinal surgeons and asked them if they had back pain, would they do surgery? And only one of the 100 said they would do surgery. So that kind of tells you something.
All right. And certainly contact Suzanne if you didn't capture the name of that book, Crooked: Outwitting the Back Pain Industry. Was that it?
Yes.
Okay. But if you lost that, I'm sure if you contact Suzanne, she will send you the name and the link for the book. And somebody again wanted to just address, how long are your patients, clients with you? Do they tend to be with you for a little while or longer? I guess, again, it depends on the issue. It depends on whether it's an issue or it's an ongoing evolution, because it's not, Feldenkrais isn't just for pain management. It's for balance, healthy living, well-being, calmness.
Aging, yeah.
Aging.
So I've been very fortunate. I've had, with some students, I've had very long-term relationships that are 6-7 years. So it varies. And then there are other people who just come for one thing. They have a shoulder, say, issue. It gets better and they're done. So I hate to say this, but it really depends. Some people become fascinated, and they want it, because it's about learning, and they want to continue learning, and so they become lifelong students of the method.
Okay, cool. Well, thank you very much for helping us launch our program. I want to thank everybody who signed up and listened and watched rather the program. Again, if you want to get in touch with Suzanne or learn more about the Feldenkrais method and her work, please go to move2livenow.com, move2livenow.com, and you can contact Suzanne at Suzanne with a Z, Ausnit, AUSNIT, at gmail.com. You can also reach us at at info@wellwellusa.com. We'll let you know we have another couple webinar sessions coming up with a range of clients starting in August. Everyone will be flagged on that. And if you're interested, please take advantage of Suzanne's special offer and see if you can get your life and your back all straightened out. So thank you very much for joining us. We're around if you have any follow-up questions, and have a great rest of the day. Thank you.
Thank you.